So, physical movement and exercise can help to improve overall fitness, and in many cases, can help to lower blood glucose levels, particularly with aerobic based, lower intensity, and longer duration activities. Glycemia tends to fall. In general, physical activity and exercise can also lead to disturbances in glycemia. We know that one of the leading barriers to exercise is fear of hypoglycemia. Therefore, CGM can be a very useful tool to track glucose levels before, during, and after exercise. Starting glucose levels and CGM trend arrows can help to reduce the risk of hypo or hyperglycemia during and after activity. With the use of CGM, rather than just focusing on the glucose number, using the trend arrow can help to preemptively treat hypoglycemia before it happens. Another important point is that CGM lag time can occur, especially during rapid changes in glucose, like during exercise. But this should not deter anyone from exercise. Rather, individuals with diabetes should simply be prepared to treat hypoglycemia earlier in cases where blood glucose may be lower than CGM during activity. It's important to be prepared to verify glucose values with a fingerstick blood glucose reading. We know that in the United States, access to CGM devices is challenging for many individuals with diabetes. For those individuals that don't have access to CGM, it's best to do fingerstick blood glucose monitoring more frequently around activity. For example, before, during, and after exercise. Starting CGM around 10 days after type 1 diabetes diagnosis, with additional exercise education starting around 1 month post diagnosis, can help to increase the knowledge and confidence around safe exercise. We have shown in a number of recent publications out of Stanford that starting CGM early is well accepted by families and newly diagnosed youth with type 1 diabetes. Early CGM access can also lead to a greater likelihood of adopting advanced technologies like hybrid closed loop systems in the future. Exercise can be a great tool to also moderate postprandial hyperglycemia in both type 1 and type 2 diabetes. In type 2 diabetes, there's quite a large body of evidence suggesting CGM should be used as a tool to modify lifestyle and improve hyperglycemia. In type 2 diabetes, it has been shown that a single bout of endurance and resistance exercise can reduce the prevalence of hyperglycemia throughout the subsequent 24-hour period. We have also recently showed that higher levels of physical activity in youth with new onset type 1 diabetes was associated with over an hour of increased time in range per day, without significant increases in time below range. So exercise education and CGM soon after diagnosis is an opportunity to improve care and establish safe and healthy physical activity habits. For more information, please visit the American Diabetes Association's Time and Range website at professional.diabetes.org/time and range.